Hey future pediatric nursing stars! Welcome back to the channel. If you're getting ready for the NCLEX, one specialty you can't afford to overlook is pediatric nursing. Children aren't just little adults. They require unique care, precise assessment, and special communication skills to meet their physical and emotional needs. In today's video, we're tackling 40 must-know multiple-choice questions that focus on pediatric nursing essentials. We'll cover everything from developmental milestones and age-appropriate interventions to pediatric medication safety, childhood diseases, and how to support families through it all. When you're caring for kids, every detail matters. These questions are designed to sharpen your critical thinking, boost your NCLEX confidence, and prepare you for real-world pediatric nursing challenges. Whether you're just starting your review or fine-tuning your knowledge before the big exam, this video is your go-to resource for mastering pediatric nursing. Let's dive in and take another step toward becoming the safe, skilled, and compassionate nurse every child deserves. 1. A 6-month-old infant with bronchiolitis is experiencing respiratory distress with a respiratory rate of 60 breaths per minute. What is the nurse's priority action? A. Administer supplemental oxygen. B. Prepare for immediate intubation. C. Encourage oral feeding. D. Monitor the infant's temperature. Answer: A. Administer supplemental oxygen. Rationale: in an infant with bronchiolitis presenting with respiratory distress, the priority is to ensure adequate oxygenation. Administering supplemental oxygen addresses the airway and breathing, which are critical in the ABCs: airway, breathing, circulation, of prioritization. B is incorrect, as intubation is not the first step unless oxygen therapy fails or the infant's condition worsens significantly. C is incorrect because oral feeding is contraindicated during acute respiratory distress to prevent aspiration. D is incorrect, as temperature monitoring is not the priority over addressing respiratory distress. 2. The nurse is delegating tasks in a pediatric unit. Which task is appropriate to delegate to an unlicensed assistive personnel UAP? A. Assessing a child's respiratory status. B. Administering oral medications to a toddler. C. Obtaining vital signs from a stable 8-year-old. D. Teaching a parent about insulin administration. Answer: C. Obtaining vital signs from a stable 8-year-old. Rationale: delegation to a UAP must fall within their scope of practice, which includes tasks like obtaining vital signs in stable patients. A is incorrect because assessment requires nursing judgment and is outside the UAP scope. B is incorrect, as medication administration is a nursing responsibility. D is incorrect because teaching requires professional knowledge and is not delegable to a UAP. 3. A 3-year-old with a new diagnosis of type 1 diabetes is crying and refusing blood glucose checks. What is the nurse's best approach? A. Restrain the child to perform the check. B. Explain the procedure using a doll. C. Skip the check and try again later. D. Administer a sedative before the procedure. Answer: B. Explain the procedure using a doll. Rationale: using a doll to explain the procedure is a developmentally appropriate way to engage a 3-year-old, reduce fear, and promote cooperation. A is incorrect, as restraining the child can increase distress and is not therapeutic. C is incorrect because skipping the check could delay critical monitoring of glucose levels. D is incorrect, as sedatives are not indicated for routine procedures and could pose unnecessary risks. 4. A 10-year-old with sickle cell anemia presents with a pain crisis. What is the nurse's priority intervention? A. Administer prescribed 4 fluids. B. Apply a warm compress to the painful area. C. Teach the child relaxation techniques. D. Assess the child's pain level. Answer: D. Assess the child's pain level. Rationale: pain assessment is the priority to determine the severity of the crisis and guide interventions. A is incorrect, as 4 fluids, while important, are secondary to assessing the child's condition. B is incorrect because warm compresses are not typically used in sickle cell pain crises and could worsen swelling. C is incorrect, as teaching relaxation techniques is not the priority during an acute crisis. 5. The nurse is caring for a 2-year-old with suspected dehydration. Which assessment finding requires immediate intervention? A. Heart rate of 120 beats per minute. B. Sunken fontanelle. C. Dry mucous membranes. D. Urine output of 1 milliliter per kilogram per hour. Answer: B. Sunken fontanelle. Rationale: a sunken fontanelle in a 2-year-old is a critical sign of severe dehydration requiring immediate intervention, such as fluid resuscitation. A is incorrect as a heart rate of 120 is within normal limits for a toddler. C is incorrect as dry mucous membranes are concerning, but less urgent than a sunken fontanelle. D is incorrect as 1 milliliter per kilogram per hour is adequate urine output for a toddler. 6. Which task can the nurse delegate to a licensed practical nurse, LPN, in a pediatric unit? A. Developing a care plan for a child with asthma. B. Administering oral antibiotics to a 5-year-old. C. Evaluating a child's response to treatment. D. Initiating a new 4-line in an infant. Answer: B. Administering oral antibiotics to a 5-year-old. Rationale: LPNs can administer oral medications within their scope of practice. A is incorrect as developing care plans requires RN-level judgment. C is incorrect because evaluation of treatment response is an RN responsibility. D is incorrect as initiating 4 lines is typically outside the LPN scope in most settings. 7. A 5-year-old with a fever is prescribed acetaminophen 15 milligrams per kilogram. The child weighs 20 kilograms. How many milligrams should the nurse administer? A. 150 milligrams. B. 200 milligrams. C. 300 milligrams. D. 400 milligrams. Answer: C. 300 milligrams. Rationale: to calculate the dose, 15 milligrams per kilogram times 20 kilograms equals 300 milligrams. A, B, and D are incorrect as they do not match the calculated dose, emphasizing the importance of accurate weight-based dosing to ensure safety. 8. A 7-year-old with a history of seizures is admitted after a tonic-clonic seizure. What is the nurse's priority action? A. Administer lorazepam as ordered. B. Place the child in a supine position. C. Insert an oral airway. D. Restrain the child's limbs. Answer: A. Administer lorazepam as ordered. Rationale: administering lorazepam is the priority to stop the seizure and prevent further complications. B is incorrect as the child should be placed in a side-lying position to maintain airway patency. C is incorrect because inserting an oral airway during a seizure is unsafe. D is incorrect as restraining limbs can cause injury and is not recommended. 9. The nurse is preparing to administer a medication to a 4-year-old. Which action best ensures safety? A. Verify the medication with the child's parent. B. Check the child's ID band and ask their name. C. Administer the medication quickly to reduce distress. D. Assume the medication is correct if it matches the chart. Answer: B. Check the child's ID band and ask their name. Rationale: verifying the child's identity using the ID band and asking their name follows the 5 rights of medication administration, ensuring safety. A is incorrect as parents are not a reliable source for verification. C is incorrect as rushing can lead to errors. D is incorrect as assuming correctness without verification is unsafe. 10. A 9-year-old with cystic fibrosis is coughing and has a pulse oximetry reading of 88%. What is the nurse's first action? A. Encourage coughing and deep breathing. B. Administer oxygen via nasal cannula. C. Notify the healthcare provider. D. Reposition the child to a sitting position. Answer: B. Administer oxygen via nasal cannula. Rationale: a pulse oximetry reading of 88% indicates hypoxemia, and administering oxygen is the priority to improve oxygenation. A is incorrect as coughing and deep breathing are secondary to oxygen therapy. C is incorrect as notifying the provider is not the first action when immediate intervention is needed. D is incorrect as repositioning alone will not address hypoxemia. 11. The nurse is teaching parents of a 6-month-old about safe sleep practices. Which instruction is most important? A. Place the infant on their stomach to sleep. B. Use a firm mattress with a fitted sheet. C. Allow soft toys in the crib for comfort. D. Keep the room temperature at 78 degrees Fahrenheit. Answer: B. Use a firm mattress with a fitted sheet. Rationale: a firm mattress with a fitted sheet reduces the risk of sudden infant death syndrome (SIDS). A is incorrect as stomach sleeping increases SIDS risk. C is incorrect because soft toys in the crib are a suffocation hazard. D is incorrect as a room temperature of 68 to 72 degrees Fahrenheit is recommended for safe sleep. 12. A 2-year-old is admitted with suspected meningitis. Which finding requires immediate action? A. Fever of 101 degrees Fahrenheit. B. Nuchal rigidity. C. Irritability. D. Poor feeding. Answer: B. Nuchal rigidity. Rationale: nuchal rigidity is a critical sign of meningitis, indicating potential neurological compromise and requiring immediate intervention. A, C, and D are incorrect as fever, irritability, and poor feeding are concerning but less specific and urgent than nuchal rigidity in this context. 13. The nurse is caring for a 3-year-old with a new tracheostomy. Which task can be delegated to a UAP? A. Suctioning the tracheostomy. B. Changing the tracheostomy ties. C. Assessing the stoma site. D. Teaching the family about tracheostomy care. Answer: B. Changing the tracheostomy ties. Rationale: changing tracheostomy ties is within the UAP scope if they are trained, as it is a non-invasive task. A is incorrect as suctioning requires clinical judgment. C is incorrect as assessment is an RN responsibility. D is incorrect because teaching is a professional nursing function. 14. A 5-year-old with a history of asthma is wheezing and has a respiratory rate of 40 breaths per minute. What is the nurse's priority action? A. Administer a nebulized bronchodilator. B. Place the child in a prone position. C. Encourage oral fluids. D. Obtain a chest X-ray. Answer: A. Administer a nebulized bronchodilator. Rationale: administering a bronchodilator is the priority to relieve wheezing and improve airflow in an asthma exacerbation. B is incorrect as the prone position may worsen breathing. C is incorrect as oral fluids are not the priority during acute respiratory distress. D is incorrect as imaging is not the first action when immediate symptom relief is needed. 15. A 7-year-old with leukemia is receiving chemotherapy and has a temperature of 100.4 degrees Fahrenheit. What is the nurse's first action? A. Administer acetaminophen. B. Notify the healthcare provider. C. Encourage fluid intake. D. Apply a cooling blanket. Answer: B. Notify the healthcare provider. Rationale: a fever in a child receiving chemotherapy is a medical emergency due to the risk of neutropenic sepsis, requiring immediate provider notification. A is incorrect as acetaminophen may mask the fever without addressing the underlying cause. C is incorrect as fluids are secondary to addressing the fever's cause. D is incorrect as cooling blankets are not the first action and may cause discomfort. 16. The nurse is preparing to administer digoxin to a 6-month-old with heart failure. Which action is most important before administration? A. Check the apical pulse. B. Verify the dose with another nurse. C. Assess the child's respiratory rate. D. Confirm the medication with the parent. Answer: A. Check the apical pulse. Rationale: checking the apical pulse is critical before administering digoxin to ensure it is within a safe range, typically greater than 90 bpm in infants, to prevent toxicity. B is incorrect as verifying with another nurse is not required for every dose. C is incorrect as respiratory rate is not directly related to digoxin administration. D is incorrect as parents are not a reliable source for medication verification. 17. A 4-year-old with a burn injury is crying and refusing to eat. What is the nurse's best approach? A. Force feed the child to ensure nutrition. B. Offer a favorite food in small amounts. C. Administer a sedative to calm the child. D. Delay feeding until the child is calm. Answer B. Offer a favorite food in small amounts. Rationale. Offering a favorite food in small amounts respects the child's developmental stage and encourages intake without causing distress. A is incorrect as force feeding can increase trauma. C is incorrect as sedatives are not indicated for this situation. D is incorrect as delaying feeding could worsen nutritional deficits in a burn patient. 18. The nurse is caring for a 10-year-old with a new cast on their arm. Which statement by the child indicates a need for immediate intervention? A. My fingers feel tingly. B. The cast feels heavy. C. I can't wait to show my friends. D. It itches under the cast. Answer A. My fingers feel tingly. Rationale. Tingling in the fingers suggests possible neurovascular compromise, such as compartment syndrome, requiring immediate assessment and intervention. B, C, and D are incorrect as heaviness, excitement, and itching are common with casts but not urgent. 19. A 1-year-old is admitted with gastroenteritis and moderate dehydration. Which intervention should the nurse prioritize? A. Administer oral rehydration solution. B. Encourage solid food intake. C. Start and 4 antibiotic. D. Monitor the child's temperature. Answer A. Administer oral rehydration solution. Rationale. For moderate dehydration in a 1-year-old, oral rehydration solution is the priority to restore fluid and electrolyte balance. B is incorrect as solid foods are not appropriate during acute dehydration. C is incorrect as antibiotics are not indicated unless a bacterial infection is confirmed. D is incorrect as temperature monitoring is secondary to rehydration. 20. The nurse is delegating tasks for a 5-year-old with cystic fibrosis. Which task is appropriate for a UAP? A. Performing chest physiotherapy. B. Assisting with ambulation. C. Administering pancreatic enzymes. D. Assessing lung sounds. Answer B. Assisting with ambulation. Rationale. Assisting with ambulation is within the UAP scope and appropriate for a stable patient. A is incorrect as chest physiotherapy requires specialized training. C is incorrect as medication administration is an RN or LPN responsibility. D is incorrect because assessing lung sounds requires nursing judgment. 21. A 3-year-old with a ventricular septal defect is scheduled for surgery. The parents ask how to prepare the child. What is the nurse's best response? A. Avoid discussing the surgery to prevent fear. B. Use simple words and a doll to explain. C. Tell the child it won't hurt. D. Wait until the day of surgery to explain. Answer B. Use simple words and a doll to explain. Rationale. Using simple words and a doll is developmentally appropriate for a 3-year-old to understand and reduce anxiety. A is incorrect as avoiding discussion may increase fear. C is incorrect as promising no pain is dishonest and erodes trust. D is incorrect as preparing the child in advance reduces anxiety. 22. A 6-year-old with otitis media is prescribed amoxicillin 40 mg per kilogram per day in 2 divided doses. The child weighs 15 kilograms. How many milligrams should the nurse administer per dose? A. 200 milligrams. B. 300 milligrams. C. 400 milligrams. D. 600 milligrams. Answer B. 300 milligrams. Rationale. Calculate the total daily dose. 40 milligrams per kilogram per day times 15 kilograms equals 600 milligrams per day. Divide by 2 doses. 600 milligrams divided by 2 is equal to 300 mg per dose. A, C, and D are incorrect as they do not match the calculated dose. 23. A 2-month-old infant is brought to the emergency department with a respiratory rate of 70 breaths per minute. What is the nurse's priority action? A. Administer oxygen. B. Obtain a blood culture. C. Encourage breastfeeding. D. Monitor the infant's temperature. Answer: A. Administer oxygen. Rationale: a respiratory rate of 70 breaths per minute in a 2-month-old indicates respiratory distress, and administering oxygen is the priority to ensure adequate oxygenation. B is incorrect as blood cultures are secondary to stabilizing the infant. C is incorrect as breastfeeding is not appropriate during acute distress. D is incorrect as temperature monitoring is not the priority. 24. The nurse is caring for a 4-year-old with a suspected fracture. Which action is most important to ensure safety? A. Allow the child to walk to promote mobility. B. Immobilize the affected limb. C. Administer pain medication before assessment. D. Encourage the child to move the limb. Answer: B. Immobilize the affected limb. Rationale: immobilizing the limb prevents further injury and reduces pain until a diagnosis is confirmed. A and D are incorrect as movement could worsen the injury. C is incorrect as pain medication should follow assessment to avoid masking symptoms. 25. A 9-year-old with type 1 diabetes reports feeling shaky and sweaty. What is the nurse's first action? A. Administer insulin. B. Give the child a fast-acting carbohydrate. C. Check the child's blood glucose level. D. Encourage rest and monitor symptoms. Answer: C. Check the child's blood glucose level. Rationale: shaking and sweating suggest hypoglycemia, but checking the blood glucose level is the priority to confirm the diagnosis before intervening. A is incorrect as insulin would worsen hypoglycemia. B is incorrect as treatment should follow confirmation. D is incorrect as monitoring without action delays treatment. 26. The nurse is preparing to discharge a 7-year-old with asthma. Which teaching point is most important for the parents? A. Limit physical activity to prevent attacks. B. Use a peak flow meter to monitor lung function. C. Administer bronchodilators only during attacks. D. Keep the child indoors at all times. Answer: B. Use a peak flow meter to monitor lung function. Rationale: a peak flow meter helps monitor lung function and detect early signs of asthma exacerbation, empowering parents to manage the condition. A is incorrect as physical activity should be encouraged with proper management. C is incorrect as bronchodilators may be used preventatively. D is incorrect as keeping the child indoors is unnecessary and restrictive. 27. A 5-year-old with a history of anaphylaxis is prescribed an epinephrine autoinjector. What should the nurse teach the parents? A. Store the injector in the refrigerator. B. Administer in the thigh during an allergic reaction. C. Use the injector for mild allergic symptoms. D. Reuse the injector for multiple doses. Answer: B. Administer in the thigh during an allergic reaction. Rationale: epinephrine is administered in the thigh for rapid absorption during an anaphylactic reaction. A is incorrect as epinephrine autoinjectors are stored at room temperature. C is incorrect as epinephrine is for severe reactions, not mild symptoms. D is incorrect as autoinjectors are single-use. 28. The nurse is caring for a 3-month-old with a fever of 102 degrees Fahrenheit. Which action should the nurse prioritize? A. Administer acetaminophen. B. Notify the healthcare provider. C. Encourage oral fluids. D. Apply a cooling blanket. Answer: B. Notify the healthcare provider. Rationale: a fever of 102 degrees Fahrenheit in a 3-month-old is a medical emergency due to the risk of serious infection, requiring immediate provider notification. A is incorrect as acetaminophen should not be given without a provider's order in this age group. C is incorrect as oral fluids are secondary to addressing the fever's cause. D is incorrect as cooling blankets may cause discomfort and are not the priority. 29. A 6-year-old with a new tracheostomy is being discharged. Which task can the nurse delegate to a UAP? A. Suctioning the tracheostomy. B. Assisting with feeding, C. Assessing the tracheostomy site, D. Teaching the family about suctioning. Answer B. Assisting with feeding. Rationale. Assisting with feeding is within the UAP scope for a stable patient. A is incorrect as suctioning requires clinical judgment. C is incorrect as assessment is an RN responsibility. D is incorrect because teaching is a professional nursing function. 30. A 10-year-old with a head injury is drowsy and difficult to arouse. What is the nurse's priority action? A. Administer pain medication. B. Elevate the head of the bed. C. Notify the healthcare provider. D. Encourage oral fluids. Answer C. Notify the healthcare provider. Rationale. Drowsiness and difficulty arousing suggest increased intracranial pressure, a medical emergency requiring immediate provider notification. A is incorrect as pain medication may mask symptoms. B is incorrect as elevating the bed is not the first action. D is incorrect as oral fluids are not appropriate in this situation. 31. A 4-year-old with cystic fibrosis is prescribed pancreatic enzymes. When should the nurse administer them? A. 1 hour after meals. B. With meals or snacks. C. At bedtime. D. Every 4 hours. Answer B. With meals or snacks. Rationale. Pancreatic enzymes are administered with meals or snacks to aid digestion in cystic fibrosis. A, C, and D are incorrect as they do not align with the timing needed for effective enzyme action. 32. The nurse is assessing a 2-year-old with suspected appendicitis. Which finding requires immediate action? A. Fever of 100.8 degrees Fahrenheit. B. Rebound tenderness. C. Poor appetite. D. Mild abdominal pain. Answer B. Rebound tenderness. Rationale. Rebound tenderness is a critical sign of appendicitis, indicating possible peritoneal irritation and requiring immediate intervention. A, C, and D are incorrect as they are less specific and urgent than rebound tenderness. 33. A 7-year-old with a history of seizures is prescribed phenytoin. Which laboratory value should the nurse monitor? A. Serum potassium. B. Serum phenytoin levels. C. Blood glucose. D. Hemoglobin A1C. Answer B. Serum phenytoin levels. Rationale. Monitoring serum phenytoin levels is essential to ensure therapeutic levels and prevent toxicity. A, C, and D are incorrect as they are not directly related to phenytoin therapy. 34. The nurse is caring for a 5-year-old with a fever and rash. Which action is most important to ensure safety? A. Isolate the child immediately. B. Administer acetaminophen. C. Obtain a throat culture. D. Encourage oral fluids. Answer A. Isolate the child immediately. Rationale. A fever and rash may indicate a contagious condition, such as measles, requiring immediate isolation to prevent spread. B, C, and D are incorrect as they are secondary to ensuring safety through isolation. 35. A 3-year-old is admitted with dehydration and is prescribed 4 fluids. Which assessment finding indicates the fluid therapy is effective? A. Heart rate of 130 beats per minute. B. Moist mucous membranes. C. Sunken eyes. D. Decreased urine output. Answer B. Moist mucous membranes. Rationale. Moist mucous membranes indicate improved hydration status. A is incorrect as a heart rate of 130 is elevated for a 3-year-old. C and D are incorrect as sunken eyes and decreased. 36. The nurse is delegating tasks for a 6-year-old with asthma. Which task is appropriate for an LPN? A. Teaching the child how to use an inhaler. B. Administering a nebulized bronchodilator. C. Assessing the child's respiratory status. D. Developing an asthma action plan. Answer B. Administering a nebulized bronchodilator. Rationale. Administering a nebulized bronchodilator is within the LPN's scope of practice. A and D are incorrect as teaching and care plan development require RN-level judgment. C is incorrect as assessment is an RN responsibility. 37. A 1-year-old with a history of heart failure is prescribed furosemide. Which assessment finding indicates a need for immediate action? A. Weight gain of 0.5 kilograms in 24 hours. B. Heart rate of 120 beats per minute. C. Urine output of 2 milliliters per kilogram per hour. D. Blood pressure of 90/60 millimeter of mercury. Answer. A. Weight gain of 0.5 kilograms in 24 hours. Rationale. Rapid weight gain in a child with heart failure suggests fluid overload, requiring immediate intervention. B, C, and D are incorrect as they are within normal limits for a 1-year-old. 38. The nurse is caring for a 4-year-old with a suspected urinary tract infection. Which action should the nurse prioritize? A. Encourage increased fluid intake. B. Obtain a clean catch urine sample. C. Administer an antibiotic immediately. D. Monitor the child's temperature. Answer. B. Obtain a clean catch urine sample. Rationale. Obtaining a urine sample is the priority to confirm the diagnosis of a urinary tract infection. A is incorrect as fluids are secondary to diagnosis. C is incorrect as antibiotics require a confirmed diagnosis. D is incorrect as temperature monitoring is not the first action. 39. A 9-year-old with a history of asthma is admitted with an exacerbation. The nurse notes a pulse oximetry reading of 90%. What is the first action? A. Administer oxygen. B. Encourage coughing. C. Notify the provider. D. Administer a bronchodilator. Answer. A. Administer oxygen. Rationale. A pulse oximetry reading of 90% indicates hypoxemia, and administering oxygen is the priority to improve oxygenation. B, C, and D are incorrect as they are secondary to addressing hypoxemia. 40. The nurse is teaching parents of a 2-year-old about injury prevention. Which instruction is most important? A. Keep small objects out of reach. B. Allow the child to play unsupervised. C. Use soft bedding in the crib. D. Store medications in a low cabinet. Answer. A. Keep small objects out of reach. Rationale. Keeping small objects out of reach prevents choking, a leading cause of injury in toddlers. B is incorrect as unsupervised play increases injury risk. C is incorrect as soft bedding poses a suffocation hazard. D is incorrect as medications should be stored in a locked, high cabinet.